Squish. Hello, Mr. Fung. My name is Ryan. I'm your nursing student today, and I'll be conducting a musculoskeletal assessment on you today. Is that okay?
Sounds good.
Great. Before we start, do we have any allergies that I should know of?
No.
All right. Great. Can I see your wristband? Tell me your name, date of birth.
Zachary Fung, January 8th, 2001.
Great. All right. So, like I said, I'll be doing a musculoskeletal assessment on you today. It requires me to inspect those muscles that I'm of interest, as well as palpate. And I'll also be doing some range of motion stuff just to see how much you can do. And then after that, I'll be just ending with a muscle strength test. So I'll be just providing some resistance to those muscles to see what your strength is for baseline at those levels. Okay?
Sounds good.
Great. So we'll just get started then. All right. Just doing a general assessment on patient. Patient appears their stated age. They do not look like they're in any pain, distress, or discomfort. They have an upright posture about them, and they appear to have equal bilateral muscle development and no signs of erythema. Okay. So Mr. Fung, now I'm just going to go do some questions for you. These are meant to help guide my assessment.
Mm-hmm.
Just answer them to your best abilities, okay?
Yeah.
Great. First of all, have you ever had any accidents or trauma to your bones, joints, or muscles?
No.
No? Okay. Are you currently taking any medications that can cause muscle weakness?
No.
No? What do you do for exercise?
I run and lift.
Okay, good. Do you have any muscle pain?
I'm a little sore after all my workouts.
Okay. Now, does this pain affect your activities of daily living?
Not too much. Just for like half an hour of rest and I'm good.
Okay, so your pain was only for a short period of time. It's nothing it doesn't go on for hours or days?
No.
Oh, great. If that pain ever does last more than your normal amount of time, days or even weeks, please contact your provider and they will do a follow-up to make sure there's nothing wrong with your muscles, okay?
Okay.
Great. But other than that, you doing great with your exercises. It's a good way to stay active.
Sounds good.
Okay. So now we're just going to go on the actual assessment, okay? So first thing I'm going to do is ask you to stand up real quick. And I'm going to ask you to bend on over. Oh, yeah. Perfect. Is it okay to roll up your shirt real quick?
Yep.
Great. I'm looking at your spine right now.
Okay.
All right. So, straight. I'm going to palpate real quick. Do you feel any pain when I press on your spine?
Nope.
How about here?
Nope.
Here?
None.
How about all the way down your lower?
Nope.
No? Okay. You can close up, and I'm going to go I'll let you sit back down. Okay. Patient's spine is in alignment, no signs of scoliosis. Patient has symmetrical paravertebral muscle development with no signs of pain or tenderness upon palpation. Okay. So next thing I'm going to do is I'm going to inspect your shoulders real quick. Okay. All right, great. I'm going to go palpate. Do you feel any pain when I press on your shoulders?
Nope.
How about your shoulder joints?
Nope.
And how about when I try to move around a little bit?
None.
No pain there?
Nope.
All right, great. All right, so patient shoulder height and girth is of equal height, symmetrical bilateral. Muscle mass is symmetrical as well. No signs of swelling or erythema, and no signs of pain or tenderness upon palpation. Okay. The next thing I'm going to do is I'm going to ask you to hold your arm out real quick, both arms. I'm going to be looking at your elbows, your wrists, and your hands. Okay. I'm going to palpate real quick. Do you have any pain when I press here?
Nope.
How's your elbows?
No.
How about over here at your wrist?
None.
I don't know, but any point of pain over in your hands over here?
Nope.
No? Okay. Great. So patient's elbows, wrists, and hands are in alignment. They're symmetrical bilaterally. They're warm and dry to the touch. No signs of erythema, no signs of swelling, and no signs of pain or tenderness upon palpation. And patient has no obvious deformities or deviations that can be seen. Okay, so now I'm just going to do see your range of motion for your upper extremities. Okay, so I want you to just do exactly what I do, and I'm just going to be looking at your range of motion. Okay.
Okay.
Great. So we're going to do shoulder elevation, depression, all right, retraction, protraction, circumduction, all right, and rotate the other way. Great. Do flexion, extension. Okay. Put your arms to the side like this, and then we're going to do external rotation, cross your arms, internal rotation. Great. And then abduction, and then adduction. Great. And then for your hand, put your fist right here. We're going to go flexion, elbow extension. Okay. And then we'll come back here. We have supination, palms up, palms down is pronation. Okay. Flexion, wrist extension. and then we're going to have ulnar deviation, radial deviation, and then for your hands, abduction, adduction, and then flexion, extension. Great. Okay. Patient has full range of motion in their shoulders, elbows, wrists, and hands with no obvious limitations in their range of motion. Okay. So, Mr. Foot, the next thing we're going to do is I'm going to do my muscle strength test. So we're going to do a lot of the similar range of motion stuff, but I'm going to be putting some resistance to those muscles just to get a baseline on your strength. Okay?
Yeah.
Great. So the first thing we're going to do is I need you to grab my hands. All right, push me away. Extension. And then pull me in. Flexion. Great. Okay. Next thing I'm going to do is try to lift your elbows up. Abduction. All right, and then bring down. Adduction. Great. All right, keep your hands like that. All right, pull out. External rotation. No, actually rotate them out.
Okay.
External rotation. And then bring that back in. Internal rotation. Great. All right. Next thing we're going to do is keep your hands up like this. Try to bicep curl my arms. Great. Flexion. And extend them. Extension. Great. All right. Next thing I'm going to do is hold your hands out. Palms down. All right. Don't let me squeeze your fingers together. Okay.
Yeah.
Okay. Great. Great. Last thing, I need you to squeeze my fingers as hard as you can. Great. Okay. All right. So patient muscle strength for their shoulders, elbows, and hands are 5 out of 5, equal and bilateral. Okay. So next thing we're going to do is I'm going to go do basically the exact same things, just we're going to go on to your lower extremities, okay?
Okay.
So if you can just move your arms real quick, I'm just going to be inspecting your hips, knees, ankles, and feet real quick. Okay. Okay. So patient's hips, knees, ankles, and feet are in alignment. They're symmetrical and bilateral. No signs of swelling or erythema can be seen, and patient's muscle contour is equal, bilateral, with no obvious signs of deviations or deformities. Okay. Now I'm gonna go palpate those hips, knees, ankles, and feet. Okay.
Okay.
Do you have any pain when I press on your hips here?
Nope.
How about any point over here?
Nope.
How about your knees?
Nope.
Okay. How about your ankles?
Nope.
Feet?
None.
Okay. Let me check for. Okay. So patient's hips, knees, ankles, and feet are symmetrical. They're warm and dry to the touch. No signs of pain or tenderness upon palpation, and no signs of edema, especially when pressing on the tibial plate. And musculature is symmetrical and equal bilaterally and has well developed. Yeah. So next thing we're going to do is just check your range of motion for those lower extremities. Okay.
Yep.
Great. So just do exactly what I do.
Okay.
Okay. So we're going to go right leg up. This is flexion, down, extension. Now other side, flexion, extension. Great. Abduction. Bring it back. Adduction. Another leg. Abduction. Adduction. Great. We're going to do knee extensions. Now bring it back. Knee flexion. Again. Extension. Flexion. Great. And now for your ankles, lift them up. That's flexion. Then down, press through the ground. Extension. And then we're going to go on the outside of your feet. Extension or inversion. And on the inside of your feet, there's eversion. Perfect. Okay. Patient has full range of motion of their hips, knees, ankles, and feet, with no obvious limitations in their range of motion. Right. So last thing we're going to do here, Mr. Fling, is I'm going to go put some resistance on we're doing those exact same movements. I'll be just providing some resistance just to see your strength level. Okay.
Okay.
All right. So the first one is going to be try to raise your knee. That's flexion, and then back down. Good. Extension. Other side. Flexion. And then down. Extension. Great. Try to push your leg out. Abduction. And back in. Adduction. Back out. Abduction. And then back in. Adduction. Great. Alright, so now I'm going to go try to kick your knee out. Extension. and then back in. Flexion, great. And kick out, extension, then back in, extension, flexion. The first was extension, and then back in is flexion. All right, now for your foot here, try to raise them up, flexion, and then back down, gas pedal, extension. All right, kick or push up, flexion, and then back down, extension. All right, great. Patient's muscle strength for their hips, knees, and ankles are 5 out of 5, equal and bilateral. All right. So, Mr. Fogg, that is all I have to do for you today. Do you have any questions for me?
No.
No? Okay. You have a great rest of the day then, okay?
Okay.
Squish.